Things Policy, a daily podcast supported by Pragati, a flagship media initiative of the Takshashila Institution. We're a bunch of policy nerds based in Bengaluru, and we like to bring a fresh perspective to Indian affairs and an Indian perspective to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
Hello and welcome to yet another episode of All Things Policy, where we discuss policy issues of relevance. My name is Priyal D'almeida, and my guest for today is my colleague and my friend Mahek Nankani, who works as an assistant program manager at the Takshashila Institution. Hi Mahek, welcome to this podcast.
Hi Priyal, thank you for having me here today.
No issues. This is going to be fun. Okay.
So hopefully I'm recording a podcast after quite some time.
Yeah, so it'll be fun. Don't worry. Okay. So Mahek, I think we all know right now, if we have read the news and etc., that recently US has been considering to expand the eligibility for the monkeypox vaccine. But we know that a lot of low-income countries are still struggling to procure the initial doses for the vaccination. And this happens with a lot of high income countries where they sort of procure a lot of doses, probably more than what they need. And that ends up having a bad effect or a sort of a problem for the low income countries to procure them, right? So this kind of concept I know is called vaccine nationalism. But can you explain this concept to our listeners a little more in deeper and a little more clearly?
Yeah. So a lot of people have different terms for it. Some say it's vaccine nationalism. Some call it my country first approach.
Right.
So vaccine nationalism or my country first approach is basically when a government of any country acquires doses through an arrangement with a manufacturer, prioritizing its own people while limiting the access of vaccine to other countries.
Right.
Then we call it as vaccine nationalism. So what happens is basically pre-purchase agreement with manufacturer and pharma companies. A lot of rich countries acquire vaccines. For example, if a XYZ rich country needs 10 doses of vaccine at the moment, but just because they have kind of money and resources, they'll buy 20 of those vaccines for themselves, which limits the number of vaccines available to other countries.
Right.
And that's been happening quite some time. It's not like it's happened in COVID-19, it's happened before as well. So this is what is called vaccine nationalism. And for example, the United States or the United Kingdom or Japan, the European Union, some countries there had spent actually tens of billions of dollars dealing with these vaccine front runners. We knew that we had Pfizer, we had Moderna, Johnson & Johnson, even AstraZeneca, of course, even before their effectiveness was proven.
Right.
And that's what limited the access of lower and poor income countries to have access to the vaccines for COVID-19. And that's how we know that even still, I'm sure India is doing much better than a lot of other countries in the vaccine rates. But we know that where US is actually trying to increase and enhance the eligibility of people who can get access to monkeypox vaccines, which is not even news today. There are war-torn countries, there are very low and middle-income countries who are still struggling to find initial doses of vaccine to vaccinate their own people.
Right.
So this has happened in previous outbreaks. It's happened H1N1, it's happened for AIDS, now it's happened again for COVID-19. But a lot of people have called out against it. WHO has been raising concerns about vaccine nationalism for quite some time. And also a moralistic problem because there is no global cooperation happening in such a scenario. And it has some consequences attached to it, of course. For example, what if a country bid against another country? So nobody takes care of such situations like that. And we know at the end who suffers are these poor people from these low and middle income countries who have no choice and who have no access to
who are probably not the starting point of the problem either.
Exactly.
And also, I remember one of the arguments was towards vaccine nationalism, for vaccine nationalism was also that, enough, I think I read it in an op-ed or something, that in the flight also, when there is oxygen mask available, they encourage you to put yours first before you put it on somebody else. That if you help yourself first, you'll be able to help others better. But in this kind of a thing, when you're sort of storing more doses than required while there are people dying, I don't think this argument really makes sense.
Yeah, and like in a case of pandemic, it's a worldly problem. People are not realizing the fact that everybody has to be vaccinated.
Yeah, exactly.
Like it can the problem, you can only control the pandemic. It's not like only rich people or rich countries have to be vaccinated. All people from all parts of the world have to be vaccinated so that we control the spread of the disease. And I was reading this news sometime back. I'm not sure, I think it was June or July. And it was like when Danish officials, they confirmed that they will be actually doing away with more than 1.1 million doses of vaccines.
Right.
Because they had so much extra and they didn't have people, and now they're coming to an expiry. So they have no other option just to do away with it. Imagine those 1.1 million doses of vaccines had not been procured earlier, could have been used for so many people from so many parts of the world.
Exactly.
So that's how vaccine nationalism comes into play.
Right. And so that brings me to another question now, that we discuss vaccine nationalism has happened during COVID as well, right? And I know a little about it was because while so many countries, low and middle income countries, were struggling to procure their first doses for their population, highly developed countries were actually having the third dose.
Yeah, they were giving their booster shot. Yeah. There was a fourth shot, then second booster shot given.
So like, how exactly did vaccine nationalism sort of affect the entire during that COVID pandemic time? Can you elaborate more on that?
See, like in the last 2 years, the world has gone through so many things together.
Right.
And in recent times, like I'm sure in past 4 or 5 decades, in recent time, there has been no situation where no one in the world was safe.
Yeah.
Like everybody, of course, there were people who were more vulnerable because of age and like health issues and all, but everybody in the world was at risk. And as we saw these extraordinary times becoming ordinary, becoming normalized, we thought like the best possible solution could have been a global cooperation of vaccine distribution. And because we knew that what we were facing in our country or people from other poorer countries, some same kind of situations were being felt, because even the best health infrastructure supported countries got down on their knees. So we knew what happened in Italy. We knew what happened in the US, at UK at one point in time, and all of those countries. So we saw vaccine development and vaccine distribution and ultimately getting out of the pandemic as the only signs of hope.
Right.
But nevertheless, the equitable supply of vaccine did not happen. There was a nationalistic or my country first approach being followed for both acquirement and distribution by many countries, and which ultimately failed the idea of health for all.
Right.
And as now we don't really talk about it because lives have gone back to normal, touch wood, but it's very important to look back at what countries and like how did they acquire and procure such large quantities of vaccine when in the first place they didn't even need it. So for example, Canada or Switzerland, they had or they acquired more than 4 to 7 times of the amount needed to vaccine their entire population by multilateral or bilateral agreements for multiple vaccines. Even Greece, France, United Kingdom, Germany, and several countries joined them. So we know that these countries had vaccines much before than the rest of the world had access to. And decisions like this, we thought that decisions like this put manufacturers also in the jeopardy. But according to me, the foul play was done from both the end. I mean, a lot of pharmaceutical companies were also at fault because they were portraying that the idea was to aid to the humanity at minimum cost, but at the end of it, it was really not. It was actually getting most strong-holding financial stocks for their vaccine production. And there have been data-driven research which show that most vaccine doses in 2020 and 2021 were estimated to be produced in rich countries like the US or the China, United Kingdom or South Korea. And each of these pharmaceutical companies had their agreements to sell their vaccines depending on the estimated profit that they were getting from all of these countries. And of course, that's why the impoverished countries like like India is still far better. Like impoverished countries like Malawi, South Sudan, Togo, and others were left far, far behind. And we know that Afghanistan went to its own turbulent situation because of Taliban. Then what happened in Ukraine, of course. So Syria, Libya, all of that. So these countries were already dealing with so many domestic issues.
Yeah.
At the end of the day, they still don't have. I'm not exactly sure, like what are the rates of vaccination currently, but I'm pretty sure they're alarmingly low for all of these poor countries.
Right.
So that's how vaccine nationalism unfolded during the COVID-19 pandemic, and actually just failed the idea for providing health access to all people irrespective of their socio-economic conditions. Like what happened is like this approach is people are not understanding it. The approach is self-defeating because nobody is safe until everybody is safe.
Right. And I think that's what a lot of people tend to forget, right? Because in the pretext of protecting your country and your people, you are sort of limiting the access to these kind of things to the poorer people or the poorer countries or even middle income countries where people might keep shuttling between these two countries and stuff, which is at the end of the day puts everyone at risk.
Yeah, and those doses which went in waste, which got expired, could have actually saved so many lives.
Exactly, because when you think of it, 1.1 million doses is not a small number.
Yeah.
That is probably a population of a city somewhere in a bigger country, in a poor country which is quite large, bigger in size. So in these kind of things, like obviously, I mean, I know WHO has been raising concerns about it, but the fact that like nothing...
Yeah, the governments and authorities are really weren't really doing anything about it. Like US, of course, later agreed to supply some of their vaccine, but this was actually after months of bureaucracy.
Yeah.
Like months of decisions going back and forth, and even like European Union was fighting with the UK regarding AstraZeneca not working. So all of these plays, I would rather name it as foul plays, being played between all of these rich countries could have been avoided and would have saved so many lives in other parts of the world.
That's true. Yeah. So before asking another follow-up question on it, let's take a short break and we will be right back. Hello and welcome back. We were discussing about vaccine nationalism. Mahek and I were talking about it. So now, resuming to our conversation, Mahek, you, I think, initially also mentioned that vaccine nationalism has also been present even before the COVID-19 pandemic. Though, like, obviously, COVID-19 pandemic brought it at the forefront and pushed all our attention to it. But this has happened in the past. Can you, talk about it a little bit in the sense, where exactly has it happened? What are the cases where we've seen it?
So you rightly said that everybody's been talking about it right now, and especially after a lot of human rights groups and WHO has raised concerns over it.
Right.
And we have seen people dying because of lack of vaccines at the end of it. So everybody's talking about vaccine nationalism during COVID, but it's not the first time that it's done. There have been several research studies, there have been papers published that how rich countries have been doing this for a lot of other diseases.
Right.
For example, I'm sure a lot of our listeners would remember when there was this swine flu H1N1 influenza virus breakout. I think it was in 2009.
Yeah.
And during that swine flu pandemic, many rich countries had gotten into agreements with manufacturing units to get the initial supplies, and initial supplies were in large numbers.
Right.
So these prevented vaccines from reaching people from the middle and low income countries on time. And of course, we know a lot of people had died of it later also. And in India also, it became an issue of health concern.
Right.
But I know that although a lot of rich nations later point in time did come forward to help the lesser developed ones, but they only did it after ensuring that people in their countries were vaccinated, irrespective of understanding the severe and serious, much more serious health concerns in other parts of the country.
Right.
And similarly, for HIV patients as well, antiretroviral drugs for the treatment of HIV patients were unavailable in Africa, which was actually the worst affected region. I remember I was seeing this movie. It's called Fire in the Blood, and if I'm not wrong, I think it's by Mohan Dylan. It's on HIV, and it also covers some bits of pieces of India as well, where it's focused on most parts of Africa. And I remember this one line that has stayed with me. I watched it a couple of years back, and there was this lady who said it, we're not dying because we are sick, we're dying because we are poor.
Right.
So like it's happened before, and like for a lot of countries do not also allow generic drugs to be available and vaccines to be available. And it's actually estimated that for HIV AIDS, which has said to have led over 3 lakhs deaths, could have been prevented had vaccines and others like other medical treatments were available in Africa from 2000 to 2005.
Right.
And the delay of the treatment reaching the region was the biggest reason for those 3 lakh deaths. And like we don't realize 3 lakh is such a huge number. Imagine those 3 lakh people could have been alive. And with vulnerable countries often receiving late access to treatments, to vaccines, to drugs, to medicine, also non-allowance of generic drugs because of patents has actually shown how low value we attach to people from these countries.
Right. But if I were to sort of, I completely understand your viewpoints about, how there has been so much of delay in, like, obviously the vaccine nationalism has prevented the low and middle income countries from getting the rightful doses or something. But if I were to defend vaccine nationalism in some sort of way, like if we have to look at it from this perspective, then isn't it right for the governments to sort of protect their own citizens? Like, they're doing it's sort of like a very, us and we approach, right? So, and that's though from a very outsider point of view, it might look very selfish, but what if at that given point of time, this is what is justified for them?
Yeah, like a lot of governments, I remember, had the point of say, a lot of people also have the point of view that the government responsibility is to protect their citizens and not every citizen of the world, which if you think can be right or justified at some points in time, but you have to know in situations like the COVID-19 pandemic, it cannot be a zero-sum game. You have to understand that vaccine nationalism is not just, I remember there was what WHO had given a statement that it's not only an issue of moral at the end of the day. So vaccine nationalism is not just morally indefensible, it's actually self-defeating in epidemiological terms, and it's also very clinically counterproductive. So I get where people say like, oh, we have to save our people first and then we'll think about the rest. But you have to understand that limited supplies and overwhelming demand and people suffering more create more losers than winners at the end of the day, especially with the pandemic because of the transport being open and like, of course, people commuting from one part of the world to the other. You have to understand that everybody has to be vaccinated. Safe and allowing the majority of the world's population to go unvaccinated will unnecessarily create illness and deaths and ongoing like continuous lockdowns, shutdowns, economic breakdowns. And of course, there will be new mutations, more people will suffer. So all of this will affect
everyone.
Everyone. If not health-wise, but economically, everything will be affected. So I am not of the point of view that just because to protect our citizens, we should let other people die. And also in this, especially the case when we are over purchasing things we don't even need.
Sustainability is what we need to like go for, right? So now that we've discussed so much about what are the problems associated with this and what exactly happened, etc., what do you think is a solution to this problem? Like, I know WHO is raising concerns, but like, what is the way to sort of prevent this from happening? Like, what is a vaccination for vaccine nationalism?
Yeah, that's a good question. Actually, the vaccine for vaccine nationalism is vaccine equity. And we have to understand that the need for health for all has not been felt like this urgently than ever before. And we have to realize this might not be the last pandemic we face. Every year, there is some kind of, there will be epidemics, there will be more pandemics, there will be more mutations. We never know what new variant of COVID comes into play. Like recently there was a new variant which was making noise in Europe. So we have to fight together as a world. We need more accelerator programs like WHO's COVAX initiative, which aims to accelerate development and manufacture of the COVID-19 vaccines.
Right.
And it also guarantees fair and equitable access for every country in the world. So I think vaccine equity prepares to build that safety net for countries and people which have nothing to fall back upon to. So, and apart from that, I think what countries need to be more morally forward in this, like for example sharing of technology. I remember some countries had the formula for vaccine much more than other countries. So of course sharing of such technology, sharing of such information, it's actually at the end of the day nothing but humane, and that will help us to achieve equity. We need more and more countries to produce vaccine at much lower prices, which also has another tangent of patents and contracts and everything being involved. So the agreement between AstraZeneca and the Serum Institute of India to produce vaccine for developing countries, for example, is one of the such partnerships we need more in future. So there is no better way than vaccine equity. And like, for example, in COVID-19 pandemic also, we knew that we needed herd immunity, and we'll be only able to achieve it once 70% of the world population is fully vaccinated, which there has been so much delay to this. So we know that because of this, there will be more overburdened health systems. And of course, it will also give a more better environment for all other diseases to probably sustain. So at the end of the day, we need global cooperation, and we have to realize there can be no sole winner of this race, because this is a race not against each other, but together against the disease and the sickness.
Yeah, and also because when I remember the COVID pandemic had hit and all the countries were going through their own struggles with, like, you know, people suffering, economies going down and everything was like, oh, we'll get through this together. It was all like, oh, we will sort of sort this out together. But the minute the vaccination came into picture, all countries started fighting about who will get more control of number of doses and all of that.
And now we're talking about vaccine nationalism. Then there will be, of course, vaccine amongst races, amongst ethnic groups. At the end of the day, it's basically the privilege getting vaccine first. So I know if we solve vaccine, if we know the problem of vaccine nationalism, how will you solve the problem of gender bias and vaccine? So we know we have data in India also, like how certain sections of society got vaccines much more than other sections of society, which is also wrong. So if you ignore one of these problems, it's not like you won't have another problems to face about.
But tackling the problem as it comes, when you know that there is a problem, and you know that these are the things that are leading to the problem, if you tackle one, it becomes slowly easier to untangle the rest of the problem and kind of sort it.
And we are yet to discover so many new things about the COVID-19. It's the virus and its variant, and we're still in the midst of it. And this is, as I said again, this is not the last pandemic. We'll see there will be other diseases as well. And only every time a global cooperation strategy will help all of us get out of such situations safely. A self-interested hoarding strategy will only prolong the existence of the disease. And the bottom line is that if one loses,
everyone loses. That's actually a good point. So with that, we will bring an end to this episode. Thank you, Mahek. Thank you for joining me today. And it was a really fruitful and informative conversation.
Thanks, Priya. Thank you for having me.
Yeah, thank you so much. Bye-bye.
Bye.
If you liked our show, don't forget to check out other interesting podcasts on the IVM network. You can tune into them on the IVM Podcast app, ivmpodcast.com, or wherever you listen to your podcasts. You can also follow IVM on social media. The handle is @IVM Podcasts on Twitter, Facebook, and Instagram. And hey, if you'd like to dive into Takshashila's research on technology, strategy, and economic affairs, check us out at our Twitter handle @TakshashilaINST or our website takshashila.org.in.